early learning, talk to the Ministry of Education about that. But my message to all New Zealanders is if you can keep your kids at home, please do keep your kids at home.
What is also, you said that 80,000 packs have been sent out in English, 10,000 in Māori. How many packs are still yet to be sent out?
Look, our capacity to send those out is growing by the day. You know, we're continuing to grow our ability to do that. We know that we could send, the supply line that we've got set up now is capable of supplying about 500,000 packs if we need to do that. And obviously, if the longer this goes on and the longer we need to keep supplying that material, then we will continue to do that.
I have a question around hospital and aged care facility visits. What will restrictions under level 3 change? Will people be able to visit their dying loved ones now?
We're still working on that guidance and working with our hospitals and aged care facilities. We've seen in New Zealand, even under the lockdown, a number of clusters inside aged residential care facilities. So in that setting, I think we want to be particularly careful. But I am very keen to extend the compassionate. There already exists an opportunity for people to visit loved ones who are dying under compassionate grounds. That is not the case if the person has COVID-19. You'll recognise there is that restriction. It's that latter that we're particularly looking at, whether there may be any flexibility under Alert Level 3.
And hospitals for like pregnant women and
yes, those are being reviewed, so we will make announcements further about that.
But then people can have, healthcare workers can have adequate PPE around COVID cases who are vulnerable or have underlying conditions. Is there an argument that family members with the right PPE should be allowed in there as well, and why not get a bit more cracking with that work so that people aren't left alone without their families?
Yes, so the work is cracking along, and that is one option, is to make PPE available for family members in that situation.
Okay, we'll come to that here.
Thank you. Just back on schools, what are the public health implications of those schools that operate in modern learning environments? You talked about the issue of open spaces. As I understand it, some MLEs also have less favourable ratios of students to bathrooms and wash basins. So what are the unique sort of challenges that are posed by MLEs, and how can the government sort of deal with those?
So the Ministry of Education are working with schools over the coming week to deal with all of their individual needs and requirements. My key message again is we want to have as few students at school as possible, because even in a modern learning environment, if you can keep the numbers low enough, there are ways to manage that. One of the things the Ministry of Education are working through with schools are things like cleaning, for example. So if you've got different groups of students using the same bathrooms, can they be cleaned in between so that you're keeping that bubble nice and tight? So all of those logistical things are being worked through with schools and early learning services over the coming week.
GPs were expecting a second wave of funding to get them through the second half of the lockdown, but that hasn't happened. How come?
We were just talking about that before, and I'll let the Director General answer that question.
Thanks, Minister. So there have been two payments already to primary care, to GPs, an initial payment of $15 million and then a further payment of $11 million out around the country to help offset the costs of their response to COVID-19. There is an active conversation between the Minister and general practice leaders and the Ministry on further funding. So that's ongoing, and I can't comment any further on it.
We understand that 11 million was promised to them though, and now is being withheld from them. A lot of them have budgeted and staffed for that $11 million to be in their bank accounts, and now it's just being taken away from them.
I don't think it's been taken away, but the conversation is ongoing and active between those three parties, as I said, about any further funding that is needed to support the COVID-19 response that is happening in primary care.
So $11 million extra promised to them?
I can't comment on that. I know the conversation's ongoing.
Dr. Bloomfield, Dr. Bloomfield. It's a morale issue from what I've been told. They've been promised this funding, they're trying to ramp up for the tsunami of patients that they're expecting after the lockdown. And then they've been told that, and they just don't feel valued because they were expecting this fund money, they've spent it in their heads. So
I think, as the Director General has just said, the conversations between general practitioners and the Minister of Health is continuing. So my advice to them would be to continue that discussion, and we'll be monitoring that closely.
Dr. Bloomfield, can you tell us just a bit more about the treatment for those patients in ICU? Are new drugs being used?
At this stage, no new drugs are being used, but you will have seen the announcement last week by the Health Research Council that is, at least two of the studies funded by the Health Research Council and some in partnership with the Ministry of Health are looking at treatments for people, particularly people who are hospitalised and with severe symptoms. Of course, we've been, because of the approach New Zealand has taken here, we've had not only a lowish number of cases, but low hospitalisation rates. And so people have been able to be treated, including in ICU, in the most part successfully. So those trials would only go ahead if our case numbers started to increase, and they are linked up to international trials too.
And also, do you think it's necessary for the Auditor General to independently review the management of PPE? What do you think will come out of that review?
Oh, well, I don't want to preempt what the Auditor General will find, but I'm certainly happy to and very pleased that he's going to do this, that he and his workers are, and I think we're expecting the results in about 4 weeks' time. So that will, I'm very open to scrutiny and review of what we have done and any feedback on how that could be done better.
But on that,
Do
you think that you could have done a better job getting that out? Because there's a sentiment there that they're not, people feel like they're not protected.
Mm-hmm. Well, I think this is a topic we've covered repeatedly. Look, I think we have stood up a system nationwide to ensure that our stocks we have are distributed around the country, that we have taken on that responsibility to distribute it to a whole range of providers that previously we wouldn't have, and that we have done that successfully. We have also ensured good supply lines, and I look forward to any recommendations that the Auditor General has got about how we could continue to improve that.
It's a topic that comes up repeatedly because you keep
We'll just take this question and we'll come back to you.
it's a topic that comes up repeatedly because you keep offering reassurances and we keep hearing from frontline health workers saying they don't have adequate PPE. You've stated that they have plenty of it, that hospitals aren't recycling gear to reuse it. We know that's incorrect. So why should Kiwi health workers have confidence in what you're saying in these press conferences?
Well, because I can reassure them, and the feedback I get from many workers around the country, and if I ever hear of any issues, I ring the relevant DHB Chief Executive. I know they are taking, a very personal interest in this. There is very good distribution of PPE. If any issues arise, then those are looked into. That doesn't mean that on any one day a DHB will be able to distribute all the PPE that a certain provider thinks they need on that day, but that also doesn't mean there's a problem in the system. Secondly, on the recycling, what I do understand, and I think you've said that that's incorrect, actually, that in the Auckland region, they are retaining used N95 masks because there is very good evidence from overseas that these can be cleaned and reused if necessary. So they are putting them aside, but there is no reuse of those happening. They have new N95 masks every time they need to use them.
DHB managers who are at fault with regards to not allowing staff to wear masks when they want to?
I trust DHB managers to do their job in clinical situations with the best clinical advice, which they do get from their infectious diseases specialists and their infection prevention control teams. And it's not my job to second guess those individual interactions between clinicians and those who are leading them in their clinical settings.
Okay,
Can you